Welcome to this explainer. Okay, so if you've ever had a medical appointment pop up on your calendar, you probably know that sudden, creeping spike of anxiety. And honestly, it's not even just about the results, it's the prep. You're standing there in your kitchen, staring into the fridge the morning of your scan, thinking, wait, am I actually allowed to eat this bagel right now? Can I have my morning coffee, or is that going to ruin everything? It's a completely universal, everyday dilemma that literally almost all of us face at some point. So today, we are demystifying medical scans and finally getting to the bottom of that age-old question, can you eat or drink before heading to the hospital? Okay, let's dive into this. Because this is arguably the absolute most common question patients ask their doctors. Can I eat before my scan? I mean, it sounds like such a simple thing, right? But the anxiety around messing it up is huge. Literally nobody wants to show up for an important appointment, especially after taking time off work, dealing with parking, the whole shebang, only to be told they have to completely reschedule all because they had a random piece of toast or one sip of orange juice. So we're going to break this down scan by scan, using direct insights from medical imaging professionals.
And the overarching answer to that massive looming question? Well, it depends. I know. It's definitely not the simple yes or no we all desperately crave when we're nervous, but the reality is, the answer relies entirely on the specific type of examination you're going in for. You see, the human body is incredibly complex, right? And the technology we use to look inside it varies drastically from machine to machine. Because of that, the rules for your stomach change depending on the exact tech they're using. But hey, don't worry, we are going to decode exactly what it depends on right now.
Section 1. The usually yes scans, X-rays, and basic MRIs. Let's kick things off with the good news. We'll establish a baseline of normalcy here where your morning routine actually doesn't need to change at all. So, looking specifically at X-rays, in most cases, you can eat and drink perfectly normally. If you're getting an X-ray of, say, your arm, maybe a twisted ankle, or just a routine chest scan, your breakfast is completely safe. The technology here is essentially just taking a super quick snapshot right through your tissues to look at bone or dense structures. And honestly, food in your digestive tract usually doesn't get in the way of that process at all. Now, the one big exception to flag here is if your doctor explicitly gives you special instructions beforehand. But if they don't say anything specific about fasting, you're good to go. Eat exactly as you normally would.
Let's move to and see how this builds when we talk about MRI scans. MRI stands for magnetic resonance imaging, which, relies on really strong magnets and radio waves to generate images. It sounds like an intense process, but preparation-wise, most MRI exams actually do not require any fasting whatsoever. You can keep your daily routine completely intact, no skipped meals required. However, you'll want to note that exception right there at the bottom, specialized MRI studies. And that word specialized is the crucial key that's going to open up our next set of strict rules.
Section 2. The contrast caveat, CT scans and specialized MRIs.
Now, what's really interesting about this slide is it brings us to a huge shift in the guidelines. Sometimes doctors need a little extra help seeing the really fine details inside your body, so they use something called a contrast dye. And the absolute second contrast dye enters the picture, the rules for your stomach change completely. Take a CT, or computed tomography scan, which takes these beautifully detailed X-ray images. It actually splits into two completely distinct pathways here. For a lot of standard CT scans, normal eating is perfectly fine. But if your specific scan requires that contrast dye to highlight certain blood vessels or organs, you're going to hit a roadblock. You will typically be instructed not to eat for a few hours beforehand. It's such a critical distinction. You're getting into the exact same physical machine, but the prep rules are totally different, based entirely on whether or not dye is being used.
And remember those specialized MRIs we flagged just a minute ago? Well, this exact same rule applies directly to them too. If an MRI is utilizing contrast dye, it may also require specific preparation, like fasting. This really shows us the consistent trigger across the board in all of medical imaging. Usually, it's not the massive imaging machine itself that dictates whether you can eat your lunch, it's the contrast dye. That dye is what necessitates an empty stomach, just to make sure everything goes smoothly, effectively, and safely during your procedure.
Section 3. The ultrasound extremes, empty stomach versus full bladder. Next up, we have what I like to call the absolute wild cards of the medical imaging world, ultrasounds. Ultrasounds use high-frequency sound waves to create images in real time. And get this, you are either operating on a completely empty tank or a completely full one, no in between. If you're going in for an abdominal ultrasound, so where they're checking vital organs like your gallbladder, liver, or pancreas, you absolutely must fast. The reason is that food and digestion naturally create gas in your belly, and sound waves do not travel well through gas. It basically ruins the image quality. But on the flip side, for a pelvic ultrasound, they actually want you to drink plenty of water and arrive with a completely full bladder. Why? Because a full bladder acts like an acoustic window. It naturally pushes your intestines out of the way so the sound waves can get a crystal clear view of the pelvic organs. It is a brilliant juxtaposition, isn't it? For one, you need to be completely empty. For the other, you are practically bursting. And let's be real, waiting in a hospital lobby with a bursting bladder is basically an extreme sport in itself.
Section 4. The Golden Rule. Following instructions.
So, the crucial point is, how do you possibly keep all of this straight? We've explored the usually yes scans, navigated the contrast caveat, and looked at the ultrasound extremes. But it all boils down to the real stakes of these prep rules. It's not just doctors being overly strict or making you thirsty for fun. There is a very practical, physical reason for every single one of these guidelines. Medical radiographer and educator Kelvin Luncey puts it perfectly. Proper preparation helps produce the best images and may prevent delays or repeat examinations. You see, this isn't just about passing a test at the front desk. It's about getting the absolute highest quality medical images possible so your doctor can make accurate, life-saving diagnoses. If you eat when you shouldn't or you don't drink water when you're supposed to, the images might end up blurry, obscured, or just totally unreadable. And that means you might have to go all the way home, reschedule, and do the whole stressful process all over again. No thanks.
And this brilliantly illustrates our comprehensive mental cheat sheet. Let's sum it all up. X-rays usually mean normal eating. CT scans and MRIs also usually normal eating, unless they're using contrast dye, in which case you are definitely fasting for a few hours. Ultrasounds, you're fasting entirely for the abdomen, but filling your bladder to the absolute brim for the pelvis. But please remember Kelvin Luncey's core advice. The absolute best course of action is to always follow the specific instructions provided directly by your hospital or imaging center. They are the ultimate authority on your specific, unique scan.
Medical imaging technology is truly incredible, isn't it? But as we've seen today, getting that perfect picture really is a collaborative team effort between the futuristic machinery, the medical professionals, and you, the patient, doing the right preparation at home. So I'd love to hear about your own experiences in the comments. Have you ever been asked to fast or drink gallons of water before a scan? Did you find it challenging to remember the exact rules the last time you went in? Let us know. Thank you so much for joining me for this explainer. I'll leave you with this one thought. As scanning technology becomes even more incredibly precise and microscopic in the future, how much more demanding do you think our bodily preparations will have to become just to get that perfect image? Keep that in mind, stay curious, and always remember to double-check those instructions before your next appointment.